Okay, my name is Kassim Lupao. I'm the Health and Nutrition Specialist for Pan-Africa Kenya. So far, so good. I've had a very good experience with this project, whereby I played a critical role in bringing together the stakeholders in delivering this project. You can imagine bringing together stakeholders from the Ministry of Health, religious leaders, national government administrative officers, as well as community leaders to ensure that we deliver for this project. I think that was a very nice experience. Yes, I can say there were some discoveries that I came across upon implementing the BAN project. I think most importantly was the power that the influencers wield in delivering for this project. For example, in Turkana County, I discovered that community leaders have very big influence. For instance, when the community leaders take the lead in getting vaccinated, then you will see the entire community following suit. And when I look at Makueni County, for example, religious leaders played a very critical role. For example, the bishop for the ACK Church in Makueni, he played a very critical role because he has a big congregation, and he made sure that in some of, in most of the occasions that he hosted, he made sure that he influenced people to be vaccinated. For example, they were celebrating 10 years of existence of the diocese, and he took lead in getting his booster jab, and from there, all the clergy followed, and the entire congregation, and that was an important learning for me, or a discovery that indeed some of these influencers trusted people, and they hold some power. There were a number of problems that we encountered in the implementation of the BAN project. Number one, when you look at the design of this project, in terms of documentation, the project was envisaged to run on an online platform, that is the M-Chanjo system. But you find that at some point the system could go down, or in some areas, especially in Turkana County, areas that are remote, where we cannot access internet. It was difficult to access the system where there was no network. And how we went through that was that we came up with an idea of printing registers that we were able to document manually, so that now at the end of the day, when the system is up and running, we could have health records and information officers doing the data entry into the M-Chanjo system, and we ensured that all the data was captured. So that was one. And then the other challenge was on drought, especially in Turkana County. You find that 2023, the county experienced one of the worst droughts, and you find that some population had to move in search of pasture and water, and a big population went to Uganda, some went to South Sudan, and even including Ethiopia. But towards the end of the year, we find that we experienced El Nino rains, and when the rains came, the population that had moved to the neighboring countries came back, and now we targeted those areas and ensure that we vaccinated those populations to ensure that we boosted our coverage. Yeah, the third challenge is on distance to health facilities. So especially in Turkana, distances from one health facility to another, or trekking distances to health facilities are long. And therefore, this affected the coverage of the project or access to vaccination services. And what we did in areas that, in the far-flung areas, we had to organize for outreach services in order to reach those population in the far-flung areas and vaccinate them. And I remember, for example, one of the areas that was on the border, like Lokwatuba, as much as it was very remote and very far, but through the coordination and working together with the community around, the healthcare workers and the community around, um, for instance, that facility registered the highest number of people vaccinated, despite being in a remote area, and we even documented a success story. Okay, the most memorable moment for me is during the immunization week, whereby we worked closely with the Interreligious Council to organize for campaign activities where we were able to vaccinate a very big number of people. And I want to thank the guys from Interreligious Council, both from the national level and those that are here at local level. So yeah, and I'm looking forward to this year's immunization week, whereby we may work even extra hard to make sure that we get the numbers. Okay, the key milestones for the VAN project is that number one is vaccination. So we've managed to vaccinate more than 30,000 people. And I know at this point in time where uh, the infection rate is very low and people think that COVID is no longer there. So hitting such numbers is not easy, and we had to use a lot of strategies to get those numbers. I know we are not yet there. We are targeting 50,000 or even more, and I know we are going to work towards that and make sure that we deliver. Secondly is getting the messages out there. So we've been able to use a number of avenues to uh, let people know that the importance of vaccination services, so vaccination against COVID-19. For instance, we've used the platform of FM radios, both in Turkana and Makueni. We've also used the avenue of social media, and we've used also influencers like religious leaders, local administrators, and even including the national government administrative officers. So I think that those are some of the key milestones that we've achieved for this project.